We will have remarks from Health Minister Paul Merriman, as well as SHA CEO Scott Livingstone and SHA's Emergency Operations Center Commander Derek Miller. If everyone could just please ensure that their audio and video are both muted. After our remarks, we will go to questions. Just simply need to raise your hand, feature at the top of your screen. Click on that and I will call on you to ask your question. You can then unmute yourself, ask your question, and then unmute yourself. So we will begin with Minister Merriman.
Thanks very much, Matt. Good afternoon, and thanks everyone for joining us today. Saskatchewan's vaccination program continues to make tremendous progress. After a couple of record-breaking days over the weekend, 59% of all Saskatchewan adults have now received their first shot. To put that in context, the US today is at 60% of all adults with one shot, according to the CDC. Not long ago, we were way behind the US. So it shows how quickly we can begin. We've been vaccinating people in Saskatchewan and how high our uptake has been. Over the past few weeks, we are getting very close to our step 2 target in our reopening roadmap, which is 70% of everyone 30 and older. Today, we are at 68%. All of this thanks to the tremendous work of our dedicated healthcare professionals, working in our vaccine clinics and pharmacies and hundreds of locations all across the province, giving thousands of shots every day. And it's thanks to the hundreds of thousands of Saskatchewan residents who are doing their part by rolling up their sleeve and getting vaccinated. Uptake in our province has been fantastic. I know there were some predictions that it would start to taper off as we got to the lower age group. That just hasn't been the case at all. In fact, we had our 2 biggest days to date with vaccinations when we got down into the 20s for eligibility. I know the drive-thrus were busy all weekend, mostly with young people, until we ran out of vaccines. The good news is we're getting more vaccines and we'll be reopening the drive-thru in Saskatoon and Regina tomorrow. So today, I want to especially thank all the young people in Saskatchewan, all in their 20-somethings who are doing their part, rolling up their sleeve and sticking it to COVID. Please keep it up. Today, we want to talk about our plan for vaccinations in Saskatchewan schools. As you know, the Pfizer vaccine is now approved for children 12 and older. So we will be providing the opportunity for every student 12 and older to get their shot at their school. I'm going to let Scott and Derek give you more details on that in a moment.
Pfizer vaccine is now approved for children 12.
But beginning in early June, the SHA will be setting up clinics in every school in Saskatchewan to deliver the COVID-19 vaccine. Students and parents will be notified in advance when the vaccine clinic is coming to your school. I should note that you don't have to wait for the vaccine clinic to come to your school. As of today, everyone 16 and older is eligible to receive their vaccine. And this Thursday, everyone 12 and older becomes eligible. So if you don't want to wait for your vaccine clinic in your school, you can get your shot at your pharmacy, walk-in clinic, or drive-through clinic right away. Today, we also released the schedule for delivering second doses. As you can see, because of the increased supply of vaccines, we will be able to move quickly through the eligibility for second dose much faster than the first. In fact, by the end of July, virtually everyone should have a chance to get their second dose. Think about that for a second. By the end of July, Saskatchewan could be fully vaccinated. It's up to you. It's up to the Saskatchewan people doing their part and getting your shot. We are making so much progress every day with every shot in every arm. Saskatchewan becomes a safer place, and we will get that much closer to getting things back to the way they should be. But we still have a little bit to go. So please keep doing your part. Keep following all the public health orders and guidelines. Please keep yourself and those around you safe. If you haven't done already, please get your first shot. when it's your turn, and then go get your second shot. Let's roll up our sleeves and stick it to COVID. Scott?
Thanks, Minister. Good afternoon, everyone. Before I begin, I'd like to extend our condolences to those who've lost a loved one in recent days due to COVID. Every loss in the province with this pandemic is one loss too many, and it reminds us how critical it is that we find our way forward and do what we can to protect our family, our friends, and ourselves. And bringing that circle of protection to our children and teenagers is a huge step forward. Offering vaccines to students aged 12 and older is consistent with the national guidance and is safe and approved by Health Canada. A key next step in our COVID-19 immunization strategy is the introduction of school-based clinics across the province starting next month in the first part of June. Just like our campaign has been all along, we are prioritizing safety and efficiency, looking to immunize all eligible kids over a 3-week period of time, and all to be over by the time school lets out for the summer. Our public health teams are skilled and equipped at delivering school-based immunizations, and we look forward to being able to provide this as an option in our COVID vaccine delivery plan. This will be in addition to the other options that the Minister laid out that will also be available for COVID immunization through pharmacies, SHA drive-thrus, and walk-in clinics. A key component of the school strategy is the role parents or primary caregivers will play such an important role in this next stage of immunization. Many of you have had yourself receive vaccines, and we encourage you to talk with your children to address any questions or fears they may have in advance of their immunizations. Celebrate with your kids when they say yes to COVID immunization and choose to protect themselves, their family, and our province, and joining hundreds of thousands of other Saskatchewan residents who've already rolled up their sleeves. With that, I'm going to ask our EOC Commander, Derek Miller, to provide you with a few more additional details on the school COVID immunization strategy and further outline the anticipated second dose age eligibility timelines. Derek, go ahead.
Good afternoon. I'm happy to be here today to provide an update on the vaccine school delivery strategy as well as the second dose strategy update. Our immunization campaign goals remain consistent throughout the campaign. We are targeting to protect those that are most vulnerable, minimize serious illness and death while protecting healthcare capacity. We want to minimize the spread of COVID-19. We're doing that by immunizing as many people as possible quickly and safely. The school delivery strategy. We are working right now with representatives from the schools and school divisions in order to arrange all the necessary logistics to bring vaccines to schools. This includes important information like dates, times, and locations. We are working again with the local schools to make sure those align as much as possible with school schedules and other commitments like graduations and exams and any alternate learning schedules that might be in place around the province. We will be communicating information about the school delivery campaign through the school communication channels. All of the clinics will be ran in the same safe manner, consistent with all the public health orders and screening protocols and personal protective equipment that parents would have seen as they came through the vaccination clinics. Vaccine administration has been approved for children ages 12 years of age and older, and this has been endorsed nationally, and it is shown to be a safe and effective way to reduce transmission and protect vulnerable populations. It also saves lives. At this point in time, children 12 to 17 are only approved to receive the Pfizer brand of vaccine, which will be important as we roll out and start administering the vaccine. As I mentioned, we are working with the schools to make all the arrangements to bring the clinics to their location. Plans are going to vary by city and town, as well as by schools. And we plan on conducting this over a time period of about 3 weeks, starting at the start of June. We intend to operate in the school Monday to Friday during the normal school week. And during this time, we will be shifting the SHA part of the campaign to focus more on operating our other services like drive-thrus and walk-ins to Fridays through Sundays. So really focusing on the weekends for those other delivery methods and that we won't be providing booked appointments during this time. However, booked appointments will continue to be available through all of the various participating pharmacies that are located across the province. There are consent requirements as we start vaccinating this age group, the 12 to 17 years of age. Written consent will be required in all cases. This supports tracking. One consent will be sufficient for both doses. In all cases, we really encourage parents to be active in discussions with their children, review the information packages that are going to be provided out through the schools, and discuss them with their kids and talk about the importance of vaccination. There are other options available for this age group as they become available on Thursday. They don't need to wait for us to come to your school. Rather, they can actively go out to get their shot at pharmacies that are administering the Pfizer brand, or at SHA drive-through walk-in clinics that are administering Pfizer, or booking online or through the SaskVax phone line to book an appointment. In terms of second doses for the schools, students will have to wait a minimum of 21 days after their first dose of Pfizer to get their second dose of Pfizer. And this is in accordance with the manufacturer's guideline for second dose delivery. We expect that we would be providing students second doses in July and August as we close out second dose delivery to the other older populations. And we are going to be monitoring the overall uptake of second doses through the course of the summer to determine whether any school-based immunization program might be required in the fall to achieve that higher level of uptake of second doses. Looking at second dose eligibility more broadly for the province, this table outlines the dates that we anticipate changing the eligibility requirements for second doses in the province, and is more information than what we had previously provided. It essentially outlines every week from now going forward to the 26th of July, we would roll down the age as well as make an adjustment to the date of your first dose, that either one of which can provide eligibility. So it's important to remember that the second dose eligibility is based on one of those two, on age or on the date of your first dose, and that the date of your first dose is provided it's on or before that date. Once we get down below the 45-year-old, we are going to adjust to running solely off of the date of the first dose, having worked through those most at risk of COVID. Just point out that this table is a tentative guideline and is always dependent on vaccine supplies and availability. So it is subject to change, but I think it does provide a good roadmap for us over the next 2 months. Also pointing out that AstraZeneca doses haven't been accounted for in this roll down, as we're still waiting advice on the use of AstraZeneca, including the timing of second doses. That concludes the presentation.
Perfect. Thank you, Derek. Thank you, Scott, and Minister Merriman. We will now move to questions. So if you wouldn't mind just raising your hand if you'd like to ask a question, and I will do my best to introduce you. If I can't identify you from your name, if you would be able to just identify yourself and your outlet so that everyone knows who we're talking to, that would be much appreciated. Thank you. Okay, Mark Smith with CTV, if you can unmute yourself.
Hi, thanks for taking my question. I'm off the top, Mr. Merriman, you mentioned how you were happy to see the vaccine uptake that has happened in the 20s and 30-year-olds. It seems like in that 40 and 50-year-old age groups, the uptake has slowed down over the past few weeks. Is this concerning at all to the government? And is there a plan to convince people who may be on the fence about receiving the vaccine what they should do to get it and that kind of thing? Is there any plan in place to convince them?
Thanks, Mark. I think the biggest plan that we have to convince people is our roadmap here is 70%, that to be able to get through our steps. If we can get to those marks, that's why this plan was developed, is to both encourage people to get out and get vaccinated in the lower age groups so we can get back to a sense of normalcy, but also to fill in those gaps. We want to make sure that everybody has access to a vaccine, that can get in and get their vaccine. That's why this is an incentive to be able to get to those different stages, why we laid it out very carefully. So I don't think that there's a lot of vaccine hesitancy out there. I think people have been busy and they're coming in. We're seeing lots of people of all ages at the drive-through clinics, not just the young people that are coming in, but some people that are in the 40s all the way up to their 50s and 60s. So people are starting to fill in those gaps, and I'm very confident that that'll continue over the next few weeks.
Mark, do you have a follow-up question?
Yes. With summer right around the corner and 12-year-olds and up expected to be eligible for the vaccine later this week, what can we expect about overnight summer camps? They are still not allowed under the current restrictions. Is there any thought of that changing as we approach the summer?
I think I'll let Dr. Shahab touch on that one.
Yeah, thanks. So, as the minister said, the effectiveness of the COVID vaccines is exceeding expectations, and the uptake by Saskatchewan residents is exceeding expectations. And based on that, I think we really want to allow more and more activities as part of step 3. So we are actively looking at the feasibility of allowing daytime or overnight summer camps. But we have to remember, as the minister and said, that the earlier we get vaccinated, first dose and second dose, including all children 12 and older, the more confidently we can have all those activities, because we have seen through our breakthrough case numbers that once you get vaccinated, your risk of getting COVID illness is extremely low. So what that means is, we can look forward to hardly no cases or outbreaks in schools, hardly no cases or outbreaks in daycares, hardly no cases or outbreaks in summer camps if they go ahead, including with overnight stays. Secondly, there are options now with point-of-care testing, where before going off to a summer camp, you can utilize point-of-care testing. We've had great success with that point-of-care testing in schools and long-term care facilities. So there are lots of options now to do more over the summer. But to get there, like the minister said, we really have to roll up our sleeves and get vaccinated first dose and then second doses as quickly as we become eligible. And I've said this before, we have to try to make sure that the SHA, even though they're getting lots of vaccine, we have to try to make sure that they run out of vaccine before the next shipment comes. Thank you.
We'll go to Phil Tank with the Star Phoenix next. Phil, if you want to unmute yourself.
Thank you for reminding me, because I probably would have forgot. Yeah, I guess this is for the minister. How much faith do you have in, like we're doing a lot planning into June, well, the next month, especially June, with the schools and second doses. How much faith do you have in that we're going to have enough vaccines? And I just wanted to clarify something too. So like for 3 weeks, nobody will be able to book vaccines appointments. You'll have to go to the drive-through at the same time that it's happening in the schools. I just wanted to clarify that.
Thanks, Phil. No, well, I'll clarify that. We're going to be running all of our clinics, whether they're through Indigenous Services Canada, our pharmacies, our drive-throughs, our walk-in clinics, and we're also adapting into the schools as well. So we'll be going to be working on all of those simultaneously. We're going to have to reorganize a little bit within the SHA to accommodate the school rollout, because obviously there's a lot of children that need to be done. The good news is that we have them as a captive audience in the schools, so we can vaccinate a lot of kids at one moment in time. And sorry, what was the first part of your question, Phil?
Oh, just the level of faith you have in that I know we're getting more vaccines starting in June.
Yeah, for sure. You know what? Pfizer has been extremely reliable over the last few months. So that's our foundational vaccine right now. We've also got Moderna coming in and AstraZeneca, as everybody's aware. So we're very confident that we can do this over the next little while. The vaccine flow has been steady and it's increasing in June as well. We're getting more vaccines in June than we did in May, again scheduled. But we're very confident in the flow of vaccines from the federal government right now.
You have a follow-up question, Phil?
I do. We can see with the variants, especially the P1 on the western side of Saskatchewan, that it's clearly established itself now as the second variant after the UK variant. I'm just wondering what your level of concern is. We've seen what happened in Alberta. We see cases in the northwest and the southwest zones. So this might be for Dr. Shahab as well. But just what is the level of concern and how are you addressing that?
Well, I'll start and then maybe Dr. Shahab. We're certainly watching our border towns and watching it from the east and the west. We know that Alberta and Manitoba are both having some challenging times right now, and we wish them that they could get through this very quickly. But we are watching that to make sure that the P1 variant is not coming into the major centers. But I'll throw it over to Dr. Shahab for his comments.
Yeah, thanks. So, as our overall case numbers are trending down, they are, sometimes a bit high in the northwest part of the province, and we are seeing more increasing importation of P1, likely from Alberta. So that's why we still say that as we get vaccinated, as we enter step 1 and step 2, we still need to minimize non-essential interprovincial travel. Plus, we need to comply with all public health measures, including if you come back from interprovincial travel or have any concerns, get tested when you come back and on day 10, for example. So all those measures continue to control, variants of concern. And of course, we've seen that, and other provinces have confirmed that even if it's a P1 variant, a higher vaccine uptake is protective. So B117, P1, the two predominant variants in Canada, a higher vaccine uptake is protective. So the most important thing we can do is get vaccinated. Secondly, we still have a ways to go before step 3 consideration. So we still should comply with step 1 once that comes on May 30th with the guidelines. There's lots of things we can do that we couldn't do for many months, but still, enter step 1 carefully, comply with the guidance that's still in place, and continue to seek testing if you have any concerns, because a higher rate of testing and the ability to isolate is going to be an important measure in addition to vaccination till such time that our vaccination rates are high enough to really drive COVID down. Thank you.
And now we'll go to Adam Hunter with CBC.
Thank you. Dr. Shahab, any sense of how Saskatoon's doing? I know that past Regina inactive cases recently. What can you tell us about what's happening there? And are you concerned at all, or is this something that was expected with the way cases were trending?
Yeah, so I talk, several times a week with my public health and medical health officer colleagues throughout the province. And obviously, Regina is very relieved that numbers have come down. But again, once that we are at the level that the rest of the provinces, we need to hold the course. And similarly, the south of Saskatchewan has still, a bit of a high case numbers, but leveling off. But then, obviously, Saskatoon is the largest urban center. We continue to be cautiously optimistic for Saskatoon. Certainly, they've done really well in keeping case numbers low with the broad provincial public health orders. But again, all of us need to stay the course, including residents of Saskatoon. Get vaccinated, follow all current public health measures in place. Those two things are going to be essential as we enter step 1 and step 2. And similarly, Prince Albertine area, Lloydminster, North Belfast area, we are not seeing large super spreader events. We're not seeing large outbreaks. We're seeing sporadic cases, mostly, in the workplace setting, and then some secondary household transmission, investigated by public health, good case contact management. Testing is key. Seeking testing if you're unwell and staying home is the first step in controlling transmission. But again, as we enter step 1, we can have larger outdoor gatherings. We can have up to 10 people indoors. We can have, up to 10 people outdoors, which we can still have now, and up to 30 people indoors public gatherings. We need to start planning ahead because, what are we comfortable with? Are we comfortable with making sure that everyone who comes to a house is fully vaccinated? Start having that discussion with friends and family, because even though we'll be able to do more come 30th May, we still need to do this cautiously, carefully, with consideration, and to avoid as much as we can large super spreader events. Thank you.
You have a follow-up question, Adam?
It's on the vaccine second dose delivery. Is there a recommendation on how long people should wait, depending on if we get vaccine sooner than we do, or we see things really moving quickly? Is there going to be a chance for people that were vaccinated, let's say a couple of weeks ago, to be vaccinated before the 13 weeks, before the 10 weeks, or is it going to be? I guess what's the recommendation on that?
So maybe I can make some initial comments and Derek and Scott can add. But, I think we have to remember that the delayed second dose strategy has served us well, and like it served the UK well. We have learned over the last 5 months that even a single dose has protected us really well. Our breakthrough reports show that even with one dose, 3 weeks after one dose, we had great protection. But now is the time to focus and finish. So while we had up to 16 weeks to get the second dose, because of improved vaccine supply, currently second dose will start at 13 weeks, but that timeline can get compressed safely. And as over May, June, you may be getting second doses at 8 weeks, for example. And then in July, you can get your second doses as soon as 3 weeks for Pfizer and as soon as 4 weeks for Moderna. So all that is looking very positive. The only caution that was mentioned was that for AstraZeneca, it's a different vaccine. There, the optimum protection is actually at 12 weeks. So while you can get the second dose at 8 weeks or even 4 weeks, for AstraZeneca, the optimum protection is at 12 weeks. For other vaccines, Pfizer and Moderna, you can get your second dose as early as 3 weeks for Pfizer, 4 weeks for Moderna. So if these timelines start getting compressed over June, July, allowing all of us to focus and finish as early as end of July, which would be remarkable, that is perfectly fine. Thank you.
And we'll take our next question from Roberta Bell.
Hi, my question is regarding consent. From what I understand, it's 13 here in Saskatchewan, but you noted that there's going to be a consent component. So can you just clarify how older students are going to be giving that, or will they require their parents as well?
At the age of 13, they can give self-consent. A 13-year-old is allowed to do that under Saskatchewan law, and this is something that aligns with the court's ruling. We've also checked across jurisdictions in Canada, and they're all doing very similar. Now, they might have a different age in there, but they're all very similar in what we're doing, and maybe I'll let Scott elaborate a little bit more on that, but we are consistent what is happening across the country. And again, we're encouraging, this is a good opportunity for everybody to get out and get vaccinated. The more people we have vaccinated, the higher our numbers go, the faster we can get back into recovery. So we're encouraging everybody that is under that in that 17 to 12-year-old range is either come out and get vaccinated right away if they can in the drive-thrus or the walk-in clinics, or wait till we get to their school. We'll be coming to their school in the beginning of June. Scott?
So the only thing I'd like to add, Roberta, is, this mature minor consent process is not new. It's not something that was created for the COVID vaccination program. This is normal for our province and normal for the delivery of healthcare services. So with respect to those older kids, 13 to 17, they do have the ability to consent themselves. But as we talked about at the very beginning of the presentation, I think it's very important for the family to sit down and talk about the importance of getting vaccinated and having those conversations, particularly with the kids, regardless of their age, to ensure that there's no nervousness or hesitancy around receiving the vaccine. But certainly we are following the age of consent and mature minor process that we normally follow for all healthcare services in the province, not just for the COVID vaccination program. It wouldn't be seen all the time through our normal immunization program, because that's focused on kids in grade school where they require their parents' consent. But this is just another nuance that we are ensuring that we're carrying out with the school divisions and providing those forms way up front so the parents and families, like I said, can have those conversations before vaccination time in June.
You have a follow-up question, Roberta?
Yeah, my follow-up is just regarding the strategy for rolling it out. Is it going to be a rolling strategy? So each school ideally has a clinic for a couple of days, or are you planning to do it like all at once? Can you just clarify how that ideally is going to be working?
Sure, I'll let Derek answer that question, Roberta, because he's more closer to the front line. So go ahead, Derek.
Yeah, thank you. So each of the areas right now are engaging with school divisions and individual schools to talk about the logistics of the timing of when and where those clinics would take place, and as well as being based on the schools, any requirements they might have. It will also be based on an approach where we can appropriately staff and resource all of the clinics. So it'll be in some kind of sequenced fashion. We are trying to prioritize high schools as we start off, but we won't see we'll get everybody done on one day or a couple of days. It'll be sequenced in each of the areas based on the resources that are available and that allow us to complete all of the schools before the school year is out.
And next we'll go to Joseph with CJME.
Hi, I'm wondering if you gave any consideration to making vaccines mandatory to attend school, and what would be the case against doing so when in other places you might need proof of immunization against measles or some other infectious disease?
I'll touch on that one. No, there is no plan to make it mandatory in schools or mandatory for everyone, but we're really encouraged by the uptake that we have had over the past 5 months with our vaccine rollout program. There's no plans on doing that just because we think everybody has the right to be able to choose that. And we're very optimistic that the people in Saskatchewan will make the right choice to be able to go and get vaccinated. If you're 12, all the way up to the oldest person in Saskatchewan, we're hoping that they make the right choice. And so far, we've seen the results that they have been.
You have a follow-up question, Joseph?
Yeah, I was also wondering about the latest on AstraZeneca. For the people who've had their first dose with the AstraZeneca vaccine, are they going to just have to wait for more shipments to arrive to get their second dose, or what would be the latest on mixing?
Probably Scott or Dr. Shahab, or maybe even Derek might want to touch that one.
Yeah, maybe I can speak to where nationally we are at. So with AstraZeneca, obviously supplies are coming in. So everyone who wants a second dose of AstraZeneca will be able to get a second dose. Like I said earlier, data over the last 5 months has shown that the first dose of AstraZeneca works really well, as good as Pfizer and Moderna. And that's been shown in our breakthrough studies. We have not seen large number of secondary cases with either of the 3 vaccines we have used. So excellent effectiveness, first dose. What we have also learned through ongoing studies, because initial trials happen, before vaccines are approved, but over the ongoing studies over the last 5 months, we have also learned with AstraZeneca from the UK, other jurisdictions, that if you optimize the second dose at 12 weeks, you get the highest long-term protection with AstraZeneca. So because AstraZeneca administration started in the middle of March, we will become, those of us who got AstraZeneca as a first dose will become eligible by the first week of June. So even though if the second dose timelines are compressed and your age group is getting a Pfizer or Moderna vaccine a week or 2 earlier, you should really wait till you're 12 weeks out with your AstraZeneca second dose and get it at that time. We will be prioritizing bookings for AstraZeneca patients so that they can get booked right in the week that they become eligible. And so that's one thing. And then there were some questions about what if I have some concerns and I want another vaccine as a second dose. We're still waiting for data from that, from several studies that are happening internationally, and that data is also expected end of May. So everything is aligned to give the AstraZeneca second dose at the optimum time, which is for the 72,000 people who got a first dose in March through April. the second doses at 12 weeks will be for most people starting in the first week of June and continuing till the end of June, early July. Thank you.
And we'll go to Julia Peterson with the Canadian Press.
Yes, hello. My question has to do with how many appointments are going to be cut to make room for the school shots, because I saw in the release that it was 90,000 shots that were being made available to this age group. So is that how many appointments or availabilities at drive-throughs and pharmacies that will be cut to make room for that?
I'll start, and then maybe Scott or Derek. Well, we are seeing also an increased amount of Pfizer that is coming in June. But we are scheduling all of this to make sure we're making sure that we split it up evenly. So we're not cutting any appointments. It'd just be reallocating how many appointments we have out there through, and again, our Indigenous Services Canada or pharmacy. We're going to finish off our age sequencing, which is the last part of this. And we're going right into the schools. Very similar to what we did within our long-term care facilities, is we targeted that group. It was a very captive audience. We went in there and we vaccinated a lot of people. And that's why we had such high uptake in there, in those areas for multiple reasons. But one is that we came right to them. So we're going to do it very similar to the schools and being able to come in and vaccinate them right there in the spot. So we're not pulling away from everything. We're just reallocating to finish off our age sequencing.
And Julia, did you have a follow-up question?
I did, yes, because I know the release mentioned that there would be a slowdown in what all else was available while this was happening. So what will that mean in practical terms? What can people expect?
So can I take that one, Minister?
Absolutely, Scott.
Julia, what the press release was talking about was specifically the clinics that are run by SHA. So I think, as both the Minister and Derek outlined in the presentation, as we pick up the school program in the first part of June with the target to get all school-age children vaccinated by the end of the June before summer holidays start, the SHA is pivoting our resources to focus on schools, and as Derek pointed out, to continue operating drive-throughs and our walk-in clinics, but the booked appointments will be transferred to our pharmacy colleagues in community pharmacies with over 350 plus locations across the province, and they will be handling the booked appointments throughout June. They've already started picking that up now. And with the vaccine distribution increasing, it actually ends up being more booked appointments than we were offering previously. Simply, the pharmacies are providing that service right now, working into June as opposed to the SHA.